Hi everyone, welcome to the Vulnerable Vaccination Program industry briefing. We'll get started in a moment. We will just wait for a couple more people to join. As you come in, please ensure you're on mute. And as you can see, we are recording the session. We'll get started in a moment. We'll just wait for a couple more people to join. Okay, so I think we'll get started now. So welcome everyone. Welcome to the Vulnerable Vaccination Program industry briefing. We have our Pharmacy Vaccination Hub briefing. Just please ensure you're on mute. And as you can see, we are recording. And so our session will be available on our Epicure website, on the Epicure MFIN website. We have Alison, who's doing our slides. Thank you, Alison. Before we start, I'd like to acknowledge the Wurundjeri peoples of the Kulin Nation, whose unceded lands our work takes place. We pay our respects to all Aboriginal and Torres Strait Islander cultures, elders past and present, and future generations. MFIN is committed to the healing of country, working towards equity and health outcomes, and the ongoing journey of reconciliation. MFIN also recognises and values the knowledge and wisdom of people with lived experience and celebrate their strength and resilience in facing the challenges associated with recovery. We acknowledge the important contribution people with lived experience make to the development of health and community services in our catchment. Today, our presenters are Anne Gravett, Program Manager in the Primary Care Innovation and Emergency Management Team, Laura Murray, Program Officer, Strategy and Service Design, and myself, Crystal McPhee, Acting Strategy and Commissioning Manager, Chronic and Complex Care and Aged Care. We also have Alison Lee from our procurement team, who's also doing our slides today. Thanks, Alison. A couple of things to note on housekeeping. Please ensure you're on mute and submit your questions through the Q&A box down the bottom of your screen. Questions will be taken on notice and responded to in Epicure through the MFIN website. Slides and recording will be available on Epicure after the session. So just a quick overview on primary health networks. PHNs were established to improve coordination of care to ensure patients receive the right care in the right place at the right time, particularly for people who are at risk of poor health outcomes, which are the populations who are the focus for the program. And I'll speak to this more in the next couple of slides. So why the Vulnerable Vaccination Program? This program was funded by the government to ensure continued access to COVID-19 vaccinations for vulnerable populations. Thanks, Alison. So the funding model is quite specific with its definition of vulnerable people. And we've given some examples below. So people experiencing homelessness, non-Medicare card holders, people with disability, First Nations people, people from culturally and linguistically diverse backgrounds, homebound individuals, and people living in residential aged care facilities. Within the guidelines on the documentation available on Epicure, there is also quite an extensive list of vulnerable people. So you can download those guidelines available on our Epicure website. We used a range of data from the Australian Immunisation Register, or AIR, the Australian Bureau of Statistics, Polar Data, the Australian Institute of Welfare, health and welfare, to understand who the priority populations were in the East Melbourne catchment by local government area, or LGA. We've presented a snapshot on this slide to show you what that looks like by a local government area. So for example, according to the data, Murrindindi, in comparison to other EMF local government areas, has a greater proportion of people aged 0 to 64 with a disability, and people who identify as Aboriginal and Torres Strait Islander, as well as older adults aged 65 to 74. While Monash has a greater proportion of people who speak a language other than English at home or as a second language, and they also have a larger proportion of people experiencing homelessness. I'll now hand over to Laura to talk more about the background of the program and also the design of the program itself.
Thank you, Crystal. Some of you may be aware of the grant programs we ran last year. It was in 3 of our LGAs of highest need. That was Mitchell, Murrindindi and Whittlesea. It was called the Community Pharmacy Health Promotion. It was a vaccination awareness strategy. And this was the program designed to increase COVID-19 vaccinations in vulnerable groups by giving resources and having those meaningful conversations around the importance of being vaccinated and winter planning. So this year, the design needed to incorporate service gaps, which included vaccinating homebound individuals and also residents of aged care homes who've been recognised as having barriers to vaccinate their residents every 6 months in accordance with the ATAGI recommendations. So to design this program, we needed to understand the services and barriers, and we consulted informally with pharmacists and RACH staff, as well as general practice staff and GPs, just to understand and inform our design. When we spoke to RACH staff, that was really consistent with the rest of Victoria and Australia, and that was the administrative burden with that consent. This also highlighted by different GPs who attend the RACHs as well, who vaccinated their own patients because the administrative burden to vaccinate people who weren't their patients was high. There was also an increase in decline from families consenting, so there was a bit of COVID-19 fatigue. So when we spoke to general practices, they can claim those MBS items for a lot of the services, and they were also better placed to service homebound individuals because they're just a little bit more complex. Many large practices are already servicing registered aged care homes, and they either send a GP and a nurse or 2 nurses and admin staff. So when we spoke to pharmacists who are really well placed to deliver COVID vaccines, and often find vulnerable groups have those barriers attending general practices just because it's just ease and free advice through pharmacies. So, however, through our consultation, we discovered that pharmacists couldn't claim the flu vaccines off-site. So when we're thinking about servicing RACHs, this was a bit of a limitation for those opportunistic vaccines, but that could all be given at one time, considering that consent. And also pharmacies who tried to build those relationships found that there was already existing contracts with larger pharmacies. Next slide, please. So what the aims of this program is to establish a GP and a hub in each LGA and a pharmacy vaccinating hub in each LGA to work together with the aim to increase access to COVID-19 vaccines for vulnerable populations, also provide that support to vulnerable people to receive COVID vaccinations, including facilitating tailored approaches and developing innovative vaccination activities to assist vulnerable individuals to enable access to COVID-19 vaccinations in their local areas. So I guess the benefits for pharmacies in this grant opportunity establish those connections with community health services and other services in the LGA, like the GP vaccination hub, where referral pathways can take place. So these activities will focus efforts to identify and recall and vaccinate vulnerable groups. And I'm going to put you on to Anne, who's going to talk about what these solutions might include. Thanks, Anne.
Thanks, Laura. So I guess this is a bit of a pharmacy vaccination hub in a nutshell. So as the PHN, we foresee this to be a 6-month program. The successful grant recipient will receive $10,000 for the LGA of interest. And what the proactive engagement and assertive outreach examples could look like could be things such as surveying patients on vaccination barriers, conversations about vaccination with vulnerable individuals, health promotion, having tailored spaces, particularly for people that have specific needs related to their cultural background, their physical disabilities, or mental health issues. Referral pathways, developing referral pathways to the GP vaccination hub to service homebound individuals, and supporting residents of residential aged care homes. Assertive outreach examples could mean working again, as Laura mentioned, with community health centres, assisting with homeless shelters, soup kitchens, and pop-up clinics. Next slide, please. Now, this slide's just a bit of a overview around the specific evaluation criteria, but in terms of the specific details of the proposal, please refer to the grant application for agreement and any associated attachments to support your application. The respondent, just also to note, will need to respond to due diligence requirements and mandatory criteria such as public liability, professional indemnity, and cybersecurity insurances, and note any conflict of interest. So this is also part of our evaluation. The scope of service and what MFIN would require from a capacity and capability point of view are also described in the grant application for agreement. Criterion 1, however, as part of the evaluation, is around the services to be provided, and we have, as part of the application pack, developed an activity plan template. And the aim of this activity plan template is to hear from you about the specific details of your proactive engagement and assertive outreach activities. And we want to know what activities your pharmacy will implement to enable access of vaccination to vulnerable people, why you have chosen the particular vulnerable group, and how you plan to implement these activities. Criterion 2 will focus on capability. And for this criterion, respondents must demonstrate their ability to engage people from the identified vulnerable communities, and by providing actual examples. So if you're already involved with vulnerable groups or have engagement models in place, we'd love to hear about them. And even an example could be how you've adapted what you normally would do to accommodate communities with specific needs. Criterion 3 is focused on capacity, so the ability to deliver. So we do require, as part of the response, a indication on your resource plan that identifies the roles of the staff involved, including the estimated hours allocated to the project and a timeline on the project's delivery. And then criterion 4 will focus on sustainability. As part of the, I guess, objective of this particular program, we want to actually see how we can continue to support our vulnerable communities. And we're really interested to see how your pharmacy will utilise the model that you have developed to support sustainability engagement with vulnerable communities moving forward after the program ends. Next slide, please, Alison. So this slide is a bit of just an overview again of the tender application process or the agreement process. And just to note, we do highly encourage that if you are interested in this grant opportunity to submit as early as possible. Don't leave it to the last minute. Obviously with IT issues these days, you never know. You could be right there and putting it in and all of a sudden something happens. So please do submit as early as possible. The application process closes at 2 p.m. on the 17th of April. It is via eProcure, and it is the actual link to eProcure is available on our website. Evaluation of all applications will occur between mid-April and mid-May, and notification of successful applicants will occur mid-May, whilst unsuccessful notifications will occur after the 1st of June. We'd hope that all contracts for this wonderful program are signed mid-May and executed with the aim of delivery commencing around the 1st of June. Next slide, please. Now that's the end of our presentation. As mentioned, we're happy to take any questions. I can note there's about 3 in the Q&A, and we'll take those on notice, and all responses to the questions will occur via the ePQR. So thank you again for making the time for the presentation today. We hope to receive your application. But again, if any questions, please do pop them through our ePQR link on the website. Thanks again, everyone.